We can go ahead and get started. I did get a note from somebody who's dialed in that says they can hear us, so that's great. I'll go ahead and get started, and then hopefully Jen McCormick and Brady Bizzaro can dial in. Matt, who is back at station control, if you could reach out to Brady and Jen and try to get them to dial in, we can go ahead and get started without them, and hopefully they can join us soon. But I'll go ahead and man the ship for the first few slides. Thank you, everyone, for joining us. Obviously, this is a bit unusual circumstance as far as the number of people who are dialing in. It is overwhelming, the amount of support that we're seeing here. As far as the actual way we're presenting today, we are calling from off-site. You do have a number of different people dialing in individually as listeners. Ordinarily, we have a number of people who dial in a single room. Obviously, given all the remote employees today, people who are working from home, it's to be expected that we're having a lot of satellite dial-in. As far as the people who are presenting, myself, Brady, Jen, members of the Phia Group, we are also working remotely, telecommuting. Again, social distancing. So hopefully I will try not to cough on you through the phone line. So again, this is a special presentation. This is not the usual webinar. We will probably come up with some cheesy webinar for the next month. Jen McCormick actually just notified me that it is the birthday or anniversary of the ACA. So that's a lot of fun. Maybe we'll talk about the Oh, I knew that would bring you in, Jen. It's the ACA's birthday, so maybe we'll do a webinar about that. But for the time being, let's focus on what's really important, which is, of course, COVID-19, the impact on the health benefit plans that we service and the industry at large, not only as people who service health benefit plans, but also employers, right? We have our own employees to worry about as well. So it's a bit of a two-prong attack. So, Matt, if you don't mind, we can go ahead and proceed to the next slide. Great. So again, we're going to be focusing on two things today, right? First is how do we respond as employers, right, as organizations, as people who are concerned about our own employees. And then secondly, I'd say as important, maybe not more important, but as important, is how do we advise the other employers and plan administrators and plan sponsors that we service? Because ultimately, again, I'm not going to say that despite the fact that I think our industry is defined as essential employees and essential services based on all the different advisory opinions and releases coming out of different governors' offices across the country, surprisingly, we are included as essential organizations, people who are administering these health benefit plans, financial services, professional services. I don't think we're necessarily superheroes, but we do have an important role to play. And how are we going to continue playing that role? That's really the other thing that we're going to cover today. So, Matt, if you want to proceed to the next slide. So here's the overview very quickly. We're going to talk a little bit about the latest government response. Obviously, you know, as we're talking today, who knows, new responses may come out. These releases are kind of coming out fast and hot and heavy. So we will do our best to stay abreast of recent changes. That being said, you know, there are two things we need to do as an organization and as an industry. First thing we need to do is we need to keep an eye on the news. As things come out, if you see something, say something. I hate to sound cliche, but if a release comes out, by all means, share it with us. Now, chances are we've seen it, but if we haven't, we appreciate it. Again, we see the Phia Group functioning almost as a brain trust where people can provide us with information, we'll take it, digest it, and distribute it. The second thing is reach out to us. If you want to ask a question about a specific location, if you want to ask about an industry, if you want to ask about whether something is out there that's impacting you about which you are not aware, let us know. If you are administering plans in Hawaii or Alaska, and you're saying, hey, you know, just because we're disconnected from the rest of the continental states, we shouldn't be forgotten. I agree. Ask us. Benefit plans and employer policies, like I said, not only do we need to know what we need to do as employers to be compliant with law, but how do we best serve our clients, the benefit plans? Stop loss considerations. Again, if you're not taking into consideration what you need to do in order to maintain stop loss protection, you're not really serving your clients. And again, just like everything else, anytime we're talking about new things that the plan may be responsible to pay, stop loss is involved as well. The Families First Coronavirus Response Act, you've seen different names, different terms. It keeps being updated and changed. We think that we've seen some final guidance recently. We'll talk a little bit about what the laws say. Workplace safety issues, again, returning to not only what employers that you serve, but you yourself as an employer, what you need to be doing to try and minimize the impact, and then, of course, HIPAA considerations. So, Matt, if you want to proceed. Last thing also, I know that there are some issues as far as the audio. Some people who have been dialing in have been booted. They're not really getting through. Other people are having some audio issues. Again, I apologize. Like I said, the number of people dialing in is a bit overwhelming. At the same time, we have to assume that we're not the only ones utilizing these services. Whether you're talking about internet, or in my case, trying to stream Thomas and Friends so that your 4-year-old will stay occupied while you do a webinar, all of these services are really being tasked with a new burden that maybe they haven't had to do in a few years or ever. So again, we'll try to be patient as much as possible. Consider it to be a very crowded club, and the fact that you're listening right now means you made it in the club. You got past the velvet rope. So congratulations. Who are your DJs tonight? Well, over to the left is Adam. He actually is dealing with a bit of an emergency, so he will not be joining us. So he didn't make it into the club. And to the right, I see Brady. Brady, have you been able to get in yet? I'll take silence to mean no.
There.
He's almost there. All right. Well, hopefully they'll let him in. I don't know if his name's on the clipboard. But as far as the cool people who got here early for setup for the party, you have myself, Ron Peck, Executive VP and General Counsel. And virtually next to me is Jennifer McCormick, Senior Vice President of Consulting. And frankly, when it comes to this topic, Jen, I think all we really need is you. So we can go ahead and proceed.
Oh, boy.
Yeah, tell me about it. All right, Matt, next slide. All right, so now I do want to cover, before we jump into this, Jen, and I start to pass it on to you, it's really important, I think, that people understand what it is, A, that's going on in general, and then B, what role we have to play, that being the Phia Group. Often when we are contacted regarding laws, rules, regulations, we're talking about something that is relatively old, has been in place for a long time, whether we're talking about ERISA, HIPAA, et cetera. And it's that people have new ideas, right? And they want to do something new or innovative and wonder, how does it fit into that existing legal regulatory mold? Okay. The issue here, or I don't necessarily want to say the issue, is that we're not consulting on how to take a new idea and stick it into an old process, but rather we're dealing with an entirely new situation. The laws and regulations that are coming out hot and heavy. And so it's a matter of, A, being innovative with your plan, but more so just staying compliant with existing new laws as they come out and staying abreast of what's changing, not only at a state and local level, but also looking at just the federal level as well. And unfortunately, and Jen, you'll probably agree with me on this, as we witness new laws and new regulations coming out on a regular basis, because they are coming out so quickly and in a disparate way, you may actually find that the federal rules and the state rules conflict. And so naturally, that's going to beg the question, okay, with whom do I need to comply? So not only what you need to do in order to comply, but which laws you need to comply with are going to be an important question as well. Jen?
Yeah, it takes me back to law school and con law and trying to figure out whether the federal law or the state law is going to be the one that's most applicable. And in this case, the answer is it's really going to depend on what the regulations are saying. This is something that we're actually going to be talking about when we get more into the specifics about the benefit plan design. With that, I'll turn it back over to you, Ron.
Okay, so let's go ahead and sort of finish off this slide by just reminding you that if and when you have any questions regarding what's going on right now, you can refer them to PGCReferral at PhiaGroup.com. Again, we will continue to send out releases as things we become aware of them, but in the meantime, this is a resource that's available to you. So next slide. All right. So this is, and I know that Brady had actually posted on social media that he's really excited about this next slide. He loves his pictures, which is funny. He does illustrations, but ultimately, this is something where, and you've probably heard this before, it's been referred to as a war. Okay, and I think that the president at one point called himself a wartime president in response to this. And for some, it may sound like rhetoric, but the truth is there has actually been enactment or implementation of wartime legislation, National Defense Production Act. So what this does, and again, on its face, you think, well, we're not technically at war, so what are we talking about here? Just like statements that we're declaring a state of emergency, right? A lot of this has to do with funding. It has to do with cutting some red tape, accelerating different legislation in order to respond to a difficult situation. And so that's exactly what we're doing here. So, again, things like shelter-in-place orders, quarantine orders, this is all covered by that. Additionally, you're starting to see, and we'll talk a little bit later, about fast-tracking certain drugs, right? So the FDA. We also talk about, later we'll talk a little bit about sort of loosening. I don't want to use the word loosening, but loosening requirements of, for instance, HIPAA. Right? We all know that under HIPAA, the ADA, and again, we'll talk about this later, there are certain things you can ask and there are certain things you cannot ask. That being said, a lot of those protections under law are either loosened or eliminated in response to something like a pandemic when an emergency like this is declared, what you can ask people, what you can do, what information you can seek. So, Brady, I think, are you on the line?
Can you hear me?
Yes, we can. Welcome to the party, my friend.
Wow, look at that. Finally, I was able to get through. Sorry about that mess there. Quite a few people trying to log in at the same time, but thankfully the timing was great to just pick up on this slide here because this is a really important slide. And like Ron mentioned, we're going to talk about a lot of these things in a bit more detail, but a couple of quick notes I wanted to supplement here to this slide here. We talked about at the beginning, or Ron did, how this is really unprecedented times. We have a lot of federal and state regulations being waived, ones that we never thought we'd see waived. We've seen a number of actions taken by the executive branch that really are testing the limits of our healthcare system. And so like Ron mentioned, one of those things is with the FDA, fast-tracking approval. In particular, they just fast-tracked a coronavirus test that can deliver a diagnosis in 45 minutes. So Jen will get into this more, but for FDA-approved testing purposes, those are going to be very, very important to keep in mind when you're considering what to cover under your health plan, because you're only required to cover FDA-approved tests. And we're at a point now where certain tests are being approved within days, which is unheard of. But that's where we're at. And I want to mention briefly, too, a note on compassionate use. You might hear this term used, and don't be confused about what that term requires of you as a plan sponsor. It only actually applies to providers. Compassionate use is a policy the FDA has that allows providers to try experimental drugs with patients who may have COVID-19. It does not make these drugs FDA approved. It just means that they are allowing providers to use them without fear of liability for them. So keep that in mind. And doctors being allowed to practice across state lines, another big important thing here, and we'll talk about when we get into the plan doc section, but that could have implications for your plan doc. Same thing, a big note here, expanding telehealth. Previously, CMS, Medicare, Medicaid services did not cover telehealth when you used it from your home and when you were not in a rural setting. Now they've expanded it tremendously to allow pretty much from anywhere you can have telehealth covered. The purpose of that, of course, is to try and keep people out of emergency rooms. We've been asked this question a lot, too, about whether you can receive a diagnosis of COVID-19 through telehealth. The answer is no, you can't, but doctors can prescribe medications via telehealth, and they can send patients or direct them to where they should go to receive a test or advise them on whether they should obtain or try to obtain a test. And finally, on telehealth, importantly, some of the HIPAA penalties have been waived. Ron mentioned HIPAA as well. HIPAA is still in effect, but there's a lot of waiver here. So I'll move on to the next slide with that.
Great. All right, Matt, you want to flip to the next slide? All right, great. So let's start talking about the actual self-funded plans and some of the things that we have to consider when it comes to that language and the potential implications that these new changes are going to bring to us. So as we know, hopefully no one is living in the shadows, that more and more individuals are contracting COVID-19. This is very serious, and this is a time where people are going to need to have more tests available to themselves. And as we're seeing more and more tests, that means that we're going to start to see more and more claims and more costs these plans are going to have to incur. So at the outset of this, we saw on the West Coast that there were certain DOIs, Departments of Insurance, that were starting to issue a notice that all the cost sharing requirements that would be associated with the testing were going to be waived. That was a step. And after quite a few states started to do that, then all of a sudden last week, on March 18th specifically, there was a federal law that was passed by the president that's now requiring all of the health plans to actually offer testing at 100% without this cost sharing. So what does that mean from the plan benefit perspective? So what has to be covered? This is not opening up the opportunity for every plan to have to cover any of those different types of compassionate use, non-FDA approval tests that Brady and Ron were talking about. This, at this point, means that only FDA-approved diagnostic testing is required to be covered. So that is what the benefit needs to be with the plan. So in addition to the actual testing, there are certain expenses that are related to the administration of the testing. So for example, if there are certain things that are done during the office visit, or as Brady had mentioned, during the telehealth, if there's anything that's associated as part of the urgent care, the emergency room, anything that is relating to getting that actual diagnostic testing done, that is what's going to need to be covered at 100%. However, that does not include any home testing. Actually, just this past weekend, the FDA had updated their guidelines to say that those private labs that are covering those, that is not going to be FDA approved. So that does not need to be covered or reimbursed by a plan. Also, what the rules are telling us when it comes to our plan design is that the treatment is not covered. So we have to cover the diagnostic testing, but we don't have to cover the treatment. Well, what gives? This is a brand new thing for us to have to encounter together and figure out. So CMS has actually issued some billing codes that we can refer to if we are trying to figure out what must be covered and what doesn't have to be covered. And that can help us, hopefully, to try and navigate the particular items that need to be covered. So how much? How much is this going to cost? Well, for the participants, this is going to be zero cost sharing. That means there's no deductible, no co-payments, and no co-insurance for the testing. But that doesn't mean that there is an open checkbook for the plan to have to cover the treatment, like I said. That's going to be something that we're going to have to wait and see what exactly is going to be covered, whether that would include the 14-day inpatient quarantine, whether that would include any hospitalization. That's going to be something that's up to the plan on a plan-by-plan basis to determine what they have to cover. There are also some particular limits, too. So in addition to there being the testing that has to be covered, the services are related specifically to that testing, but the plans are going to be prohibited in any way from imposing any sort of pre-certification requirements or imposing any sort of medical management techniques or fail-first protocols in order for an individual to be getting that testing. The scope of this is what's so big that we need to worry about. This is something that is going to be applicable for a fully insured plan or a self-funded plan, an ERISA plan or a non-ERISA plan, a grandfather plan, non-grandfather plan. Essentially, there's not a group health plan that's going to be exempt from this. However, keep in mind that if you're in one of those states where there were the original requirements for issuing the waiver of all the cost sharing, that it's possible that if you are a non-ERISA plan, that in addition to following what the federal FFCRA is requiring you to do, there might be a particular directive in addition, which we were talking about a little bit ago, to whatever that requirement is on the federal level. So you could be subject to a state directive or a state mandate in addition to the federal one. So as far as how long this is going to last, during this emergency period, so I really think it's going to be dictated until any sort of further guidance or notices are going to be issued. So at this time, it is required to make these modifications to the plan. So you might be asking, I have a high deductible health plan. What about that? Well, obviously things don't always catch up as quickly as they should, but now the IRS has issued some guidance that does say that a plan, if it's a high deductible health plan, is still permitted to waive the deductible or any cost sharing that could be associated with the testing and not jeopardize their status as a high deductible health plan. But keep in mind that having that waiver in place does not mean or automatically qualify that as a preventive care treatment. It just means that the status of that plan is not being jeopardized by doing so. So keeping in mind that, it does still mean that the plan, even if they're a high deductible health plan, and we know this IRS guidance has gone into place, is still going to have some plan modifications in order to allow this to be covered. It is our suggestion and recommendation that plans are modifying their plan language to account for this change. Matt, you want to flip to the next slide, please? All right. So now here are some of the things when we're talking about this amendment. The testing is obviously the most important, the most crucial. We need to make sure that the testing is being covered at 100% without that cost sharing. But in addition to that, there are some other modifications and considerations that plans must look through to figure out what the impact might be broadly for them. So the first is making sure that you're changing the actual benefit design. Is there anything in the benefit grid about diagnostic testing? If so, if there's a copay, maybe you want to caveat that to say specifically for COVID-19 testing that it is covered at 100%. Maybe this would be an opportunity too, where most states are starting to issue these stay-at-home orders or notices or advisory opinions. Maybe this is an opportunity to encourage the use of that telemedicine that you hadn't used in the past. Maybe this is a good time for you to encourage or push the use of any sort of DPC or direct primary care provider that you had in place, particularly if they already have the texting or the emails or using FaceTime to receive care. Maybe there are ways that we previously didn't take advantage of that we want to encourage our participants to use. Also, maybe we're starting to look, and we're going to talk about this in a little bit too, about this paid leave that's going to be required. Great. Now I know that certain states are, and even at the federal level, we're all required to do this, but what does that mean for the continuation of coverage? What do I want to do for my particular employees who otherwise are trying to, maybe they can't work, or maybe they're being furloughed, or maybe they're being laid off? Maybe want to continue their coverage for them. Is that something that maybe we should consider revising through the plan language? Maybe. And if you do make that modification, that you do want to allow them to continue that coverage, it has to be documented via some sort of amendment and then communicated effectively to all the relevant parties, like the stop-loss carrier. Another consideration or question that we're starting to see are individuals who are looking to modify how they're defining their actively at work definition. Maybe they're looking to include situations that you're considered actively at work if you're furloughed, or maybe you are laid off during this pandemic, this current time of emergency. Obviously, it's been our recommendation that if there is a situation where staff is laid off or employees can't work remotely, or it doesn't work for them to telework, that maybe you're considering offering some sort of leave of absence and continuing coverage that way instead of modifying your actively at work definition. The last consideration here is that you are, thanks, Matt. The next last consideration here is talking about different exclusions that could be applicable. So there are certain times where you're looking at your plan language, and this was something that we've encountered when the clinical trials came to be, is that ACA had this federal mandate that a plan, non-grandfathered plan, was going to have to cover certain things with no cost sharing at 100% for an approved clinical trial. No one knew how much that was going to cost. Everyone was concerned. So all of a sudden, the stop-loss carriers were issuing these riders to saying that they were going to be covering these benefits under the plan. Well, to make sure that there wasn't an exclusion that was in place. This might be the same situation here. Is there some sort of exclusion that is in the plan that you might need to be looking at, particularly something that says about a travel advisory or some other hazardous activity? I know that, Brady, you wanted to jump in and talk about some of these exclusions that you were encountering. If you wanted to go ahead and jump in here.
Yeah, because this is an area that's obviously very important, and we're getting questions on a daily basis about, based on developments from the federal government and the state governments, what should we be looking at in our plan docs? I mentioned before the fact that the Trump administration has directed HHS to allow both retired doctors and nurses to come back into service and to allow those providers to practice across state lines. So many plan docs have definitions of these terms, doctor, nurse, provider. And those definitions oftentimes will stipulate that the provider has to be acting within the scope of his or her license, practicing in the state in which they're licensed. So we've been asked this question about, what do we do in this instance? Will this come up? The answer is it typically will not come up that you have a provider that's particularly identified when providing services to someone, especially someone who's seeking emergency care, but it is possible. So you might want to look at your plan language, see if you have language that is defined the way I described, and you might want to amend that language because it's possible you may have plan participants seeing providers that are, traveling across state lines to help with a shortage, or coming back from retired service to help with a shortage. So be aware of that particular language. It could inadvertently serve as an exclusion if the provision of care is connected to the provider in that case. Also, with illegal acts, you mentioned too, when you have states issuing shelter-in-place or stay-at-home orders, particularly New York, the state of New York has I think the governor there noted that he would issue civil fines to people if they're out in violating this order. So technically, if you have a very broadly defined illegal acts exclusion in your plan or in your stop-loss policy, and you have someone who goes out of the house and violates this order and gets injured while doing so, that could be very relevant. And finally, and probably most importantly, a quick note here on experimental drugs. And I know Ron will touch on this too about the stop-loss issue, but you may recall, if you've been watching like I have these daily press conferences, the president had mentioned a particular drug, hydroxychloroquine was the one he mentioned, a drug that's FDA approved for malaria. The White House sent some mixed messages saying that it had been approved for the treatment of coronavirus. It actually has not been. And that's important because many plans, like we know, have definitions of this term, experimental investigational, that require FDA approval. So be wary of the utilization of drugs for off-label purposes. There are many drugs that can be used off-label to treat coronavirus, again, under the compassionate use guidelines. I believe another one was called remdesivir, which the president said had been essentially approved, but it actually hasn't been approved. So be wary of experimental drugs as new ones are being touted on a seemingly daily basis. Look at your plan language. Know that these drugs have to be FDA approved if that's what your language requires. And with that, I'll turn it over to the next slide. And I think Ron.
Hooray me. All right. So Matt, if we can get to the next slide with my awesome green book illustration. Look at that employee handbook. That is an actual book, unlike the pamphlets that we see today. I appreciate the effort. But in all seriousness, there are two things from the employer perspective that we need to look at and understand how it impacts potentially the health benefit plan, the interaction between the two. First and foremost, we need to appreciate the economic realities of what's going on. There are a number of people whose hours are being reduced, whose duties are being reduced. They're working from home, or they're being laid off, or their employment is being terminated. Specifically, when we talk about reducing hours or changing hours, first and foremost, think about the ACA. Again, Jen was very excited to announce the ACA's anniversary today. We're not talking about it, but again, you can't forget that it exists. And as an employer, there are still requirements under the ACA, especially applicable large employers. There are various obligations. Again, how you're calculating your staff demographics, determining what you're required to provide by way of benefits, what methodology you used for that staff calculation, i.e. the look-back approach. This is all going to impact what employers are required to provide by way of health benefits in general. So again, don't get so focused on the fact that we're dealing with a pandemic, so much so that you forget to look at each element of the plan's administration in sort of a sterile, almost vacuum-like approach. Along the same lines, right, if people are working from home or working fewer hours, are they still deemed to be actively employed or actively working as that term is defined in the benefit plan document, insofar as it relates to eligibility for enrollment or eligibility for benefits? We actually at the Phia Group dealt with this many, many years ago as it relates to leaves of absence, where there were employers who were telling employees, yes, please take a leave of absence. You'll still be enrolled in the health plan. We'll cover your medical expenses. And those employees were being authorized to leave work for weeks or even months at a time. They were being told, and this actually was coordinated with the employee handbook, that while they were on a leave of absence, that they would be covered by the health benefit plan. But the problem is the plan document indicated that if you were not actively at work for 30 days, let's say, you would be booted from the plan. So the problem was that under the handbook and the employer's instructions, people were out of work for more than 30 days, but at the same time, and being told that they would be kept on the plan, at the same time, stop loss looks at the person, looks at how many days they've been gone, looks at the plan document and says, hey, this guy shouldn't be on the plan anymore. Same thing still applies here. So determine what are your employees doing, how many hours are they putting in, from where are they working, and does that still create an eligibility under the plan document, or does a change need to be made to the plan to ensure eligibility remains intact? Also, when we talk about termination of employment, again, think about things like COBRA, for instance. Your obligations, if someone loses their job under COBRA, to extend that invitation to maintain coverage still exists. Now, obviously, it's going to be a lot more difficult to provide all of the necessary information to enroll in COBRA if they're not physically on site. Usually you would have HR hand over a package. It's much easier to deliver that information, but that does not alleviate you of that responsibility. As far as the handbook is concerned, again, maybe straying a little from the health benefit plan discussion, which is really the Phia Group sweet spot, and focusing in on the HR issue, you have to also make sure that you're still complying with the terms of your policy regarding things like paid time off, regarding compliance with applicable law, the FMLA, both state and federal rules, ADA rules on leave. Also, the employer policy. Do you have a policy regarding telecommuting, right? Do you have, let's say, provision regarding the physical space where the person needs to be working? We're all in the health benefits industry, right? We still deal with PHI. You still have an obligation to protect PHI. So if you're working and your spouse, who, of course, we all trust our spouse, right? They may not be allowed under HIPAA to see that PHI, right? So are you protecting PHI? Things like that, you still need to comply. And then, of course, disaster recovery, and I mentioned it before, don't focus so much on the fact that we're dealing with a pandemic that you lose sight of the facts. And the sterile facts are the fact that people can't be in the office right now, no difference than, if there were a nor'easter and people couldn't get into the office. What's your policy? If all of a sudden everyone had to telecommute, what's your policy? If somebody is sick, regardless of whether it's with COVID-19, the flu, or something else that's contagious, what's your policy? Ensuring compliance, consistent application, that's going to be the key to success here as well. Matt, if you want to proceed to the next slide. So one of the key considerations is going to be how you're communicating with stop loss. And it's interesting, from the Phia Group's perspective, we've actually been discussing the response to COVID-19 with a number of different MGUs and carriers, and you're definitely seeing the response to this. It's actually very similar to the response that we saw to reference-based pricing, as an example, where some carriers are open to allowing a benefit plan that uses reference-based pricing to pay more than the amount listed in the plan document as part of negotiation of a balanced bill. Whereas other stop-loss carriers say, look, if your plan says you pay at Medicare plus 40%, that's the law, that's the rule, strict enforcement of the plan document. Well, the same philosophies tend to be applied here. You have a lot of carriers who are saying, we understand that it's impossible to predict everything that's going to happen. Do the best you can and we'll work with you. Other carriers are saying, look, if it's not covered under the health benefit plan, we understand that COVID-19 and the pandemic is very big and scary, but ultimately when you boil it down, whether it's this or some other disease, it's still people being ill, people being sick, and certain rules need to apply. And when we issued the stop-loss policy, it was in accordance with those rules. One of the things that you need to do, regardless of how flexible or strictly adhering the carrier is to the plan document, is discuss likely issues now. If you need to make changes to the plan document, which based on the things we've discussed thus far and are going to continue to talk about for the remainder of the hour, you're going to need to make revisions and amendments and changes to your plan document. Those obviously need to be shared with the stop-loss carrier as well. It's no different than any other change you make to your plan. Additionally, we know that stop-loss carriers generally do not want to make binding decisions, tell you what to do or how to change your plan or write your plan, but you still have an obligation to discuss these issues with them to at least get a read on what their approach would be as you look to make changes to the plan. Things like off-label drugs, which Brady discussed already, things like medical necessity, fast-track medications, right? Extending coverage for reduced-hour employees. We talked about that eligibility and whether people are still actively working. Delays with COBRA notification, right? If somebody enrolls in COBRA, but there was a delay in getting them the materials and getting them enrolled, will stop loss continue to cover that person as well? Last but not least, you need to look at some of the more extreme exclusions that probably apply here: experimental drugs, international travel, leaves of absence. And one thing that we don't list here, but we talked about early on, is the fact that the federal government is triggering some powers or rights, flexibility, by deeming this to be, or at least initiating certain rules that apply during wartime, right? We talked about that. You know, a lot of plan documents, a lot of stop-loss policies exclude claims arising during or from a act of war, right? Now, again, are we talking about triggering some wartime law, or are we talking about actual conflict, physical conflict? Presumably it's the latter, but don't leave it to chance. Cover it with the carrier. Make sure that that exclusion wouldn't apply. So again, going through the exclusions of both the plan document and policy to determine what's going to apply given what we're learning and what we're seeing is going to be a key to success here as well. And with that, we can move on to the next slide and hand it back off to Brady. Brady?
Thanks, Ron. So this next few slides here is about the new legislation that passed last week that is extremely important for pretty much every employer in the country. And we've also received a ton of questions about the Families First Coronavirus Response Act. So it was really passed in shocking speed. It's the first in what will probably be a series of bills passed at the aim of relieving some of the economic stress for workers. And there are provisions here which apply, as I mentioned, to really all employers. There's an exemption for a few. I'll get to that in a second. But these laws become effective April 2nd. So you've got very little time to prepare. And there's two particular parts here that I want to point your attention to, aside from the other areas of relief referenced above on the slide here. One is the emergency expansion of the FMLA, which I'll talk about in a second. And the second is the Emergency Paid Sick Leave Act, which Jen will talk about in a few slides. And important to note, these are two separate leave requirements that each have a component that must be paid. So that's important. Also note that other states are proposing similar emergency legislation that will apply to you as an employer if you're operating in that state. And there's also a requirement that the employers provide notice about these laws to their employees, to those people who still have workplaces that are open. I believe I read that the DOL would be having a model notice by the 25th, which is, I think, in 2 days. So we can go to the next slide there, and we'll get into some of the details about the expansion of the FMLA. So this is really a sweeping and very sudden change to the FMLA. It significantly expands and amends it on a temporary basis. It's covering here all employers with fewer than 500 employees, with some exceptions. The thinking there is that for large employers with over 100 employees, many of them already have protections like this. Of course, there's some dispute about that. But in any event, for our purposes here, any employee is eligible who has worked for 30 days prior to this leave for this expansion of the FMLA. And I also want to know at the outset here, it does run concurrent with the existing FMLA. So if someone takes emergency FMLA, you can exhaust their other normal FMLA alongside that leave. So that's very important to know. Okay, so what are the reasons for why you can take this leave? Well, any job protected leave for 12 weeks will be offered for employees who cannot work or telework, who cannot care for their child under 18, if their place of childcare is closed or school is closed due to a public health emergency. Obviously, this qualifies for that. So you're going to have a lot of people who qualify for this leave. For the first 10 days of this 12 weeks, it may be unpaid, and you may substitute an employee's other PTO or vacation time in this time. After 10 days, the employer must pay full-time employees at their two-thirds of the regular rate for the number of hours they would have otherwise worked. There's a cap here, so be aware of that as well. Let's go to the next slide, Matt. And for non-full-time employees, I won't go through all the details in the interest of time here. They're on this slide, but just note that there's a separate calculation for part-time workers that you have to take into account. Job restoration, this is why the FMLA, of course, is very important, because you have the same obligations if you have 25 or more employees to return an employee to his or her normal work position after this leave expires. And again, because this is an expansion and amending of the FMLA, our interpretation, although this was not specifically written to the bill, is that health coverage must be continued. It only makes sense, right? If FMLA requires health coverage to be continued, so should this expansion of it. And it is, again, temporary. So it expires December 31st of this year. And next slide, Matt. So I'll turn it over to Jen for the next part.
Great, thanks. Okay, and one of the things that I just want to reiterate, this is, I feel like a broken record when I say this, but there is a difference between a leave of absence and a continuation of coverage. So in addition to the extension of FMLA, there is the second piece of this, which is the Emergency Paid Sick Leave Act. So one of the reasons that this was put into place was to actually help the employees so they weren't necessarily required to at first use any sort of personal time or sick time or vacation time prior to having to have some other sort of sick leave specific for this purpose. So what is this? So this is actually also a act that is going to be applicable for employers who have fewer than 500 employees. So one of the exceptions here is that the Secretary of Labor is able to issue some sort of exemptions if a business would have less than 50 employees, and if there would be a circumstance where maybe taking paid time off to care for a daughter or a son or a child because school or childcare is closed would actually seriously jeopardize the viability of the business. So there are some exceptions. Maybe that will be an exception that will grow in the past, but just know that this is something at this time that is applicable for any employer with less than 500 employees. So specifically, this is going to require that the full-time employees are being provided with 80 hours, if you are full-time, 80 hours of paid sick time. And there are certain requirements or reasons why you could take this leave. I'm not going to read these all to you, but just know that these are pretty broad categories. If there's a local quarantine, if you're advised by a provider, if you're thinking, if you have symptoms or you need some sort of medical diagnosis, if you're caring for a child or individual or someone, maybe not necessarily a family member who has been quarantined, or maybe your school is closed, like the situation for many of us until at least late April or beginning of May, or maybe some other condition that we don't necessarily know about at this time. So there are certain opportunities that you could take for this actual paid leave. Can you flip to the next slide, Matt, and we can talk about some of the specifics for the rate of pay? Awesome. Okay. So there are some other considerations here about how much this is going to cost. And if you know me at all, you know that math is not where I excel, but thank you for kind of putting this up here for you to read. There are certain requirements for what it is that an employee is going to be eligible for when it comes to their pay. So under these two separate categories, if an employee is subject to federal or state or local quarantine or in some sort of isolation, or they've been advised by a provider that they need to self-quarantine because maybe they were exposed or maybe they're experiencing the symptoms, that's when that $511 a day is going to come into play, and capping out at the total of $5,100, $10. Other circumstances are going to put you in the category of getting the 2/3. So know that there is not necessarily the opportunity for individuals to carry this over from one plan year. This is something that is going into effect on April 2nd, but it does expire on December 31st. And an employee is not required, like I mentioned before, to use any other sick time before this COVID-19, this paid emergency leave. They could if they chose to do that, but they're not required to do that. And also, this is important for employers too. This is not something that is required to be paid at the time of separation from employment by an employer. This is not something that's being guaranteed to them. And also, this is not something that an employer is going to be able to request that they are reimbursed for if there is any sort of separation. And Brady also mentioned this too, last thing before I switched over to Ron, is that right now there are no specific requirements about how notice has to be provided by those individuals who are requesting this type of leave. But it's been our recommendation at this time is that I'm sure there are some other policies, whether it's FMLA or maybe another employer-based leave policy. Use any sort of reasonable notification procedures or requirements you have in place until there's more guidance specifically on that. But there are requirements on the employee to make sure that they are providing notice. It just has to be reasonable in how they are being accepted. I'll turn it back over to you, Ron.
Thanks, Jen. Appreciate it. All right. So let's go ahead, Matt, and talk about workplace safety issues. Now, before I go ahead and get started, I do want to make one thing absolutely clear. We have received a number of questions about COVID-19 in particular, benefit plans, changing the plan, stop loss, but also workplace safety issues, which I understand probably as many of these questions are coming from organizations looking to service their clients as looking to help their own employees, and I certainly appreciate that. And we are working on another webinar or podcast, some sort of presentation that is going to focus entirely on this topic. So keep your eyes on the inbox. You will receive notifications when that's available. Additionally, a recording of this webinar and the slides will be made available as well. We know a number of people have had difficulty dialing in because of the volume, not only of our webinar, but also the service provider in general is being inundated by all the people telecommuting. So we totally understand and we'll make this available to you. Looking specifically at this topic right now, again, OSHA and different organizations, they basically categorized or put different employers into categories. I believe there are 4 risk zones or 4 risk categories. Honestly, the top 2, you're talking about people who are dealing with sick patients, people who are actually in the provision of healthcare, people who are handling the tests, right, the samples, the people you see on television wearing the hazmat suits and the full protective gear. I'm not going to tell you what rules and regulations apply to them. Frankly, you can imagine. And if you're calling in right now and you're someone who falls into one of those risk zones, the first 2, you should probably be educating me, not the other way around. So, this is really more for the desk jockeys and other, people like us who are sitting here at our computers thinking, okay, well, what am I supposed to do? And the first thing that really, if you read these rules and what you need to do as far as keeping the hazards contained, reduced, clean, it's incredible. Wiping down surfaces with a bleached mixture. If somebody is exhibiting any symptoms, sending them home. Anyone who's in physical contact with them, sending them home. Monitoring their symptoms, getting them tested, cleaning the area, opening the windows, wiping everything down. Honestly, even if it wasn't already a great idea to have people work from home, just the amount of work you would need to put into handling the situation if and when somebody sneezes in the office makes it less of a burden to just have everybody work from home. But there's a reason for this. And as an employer, as just a human being, someone with a family, with contact with other human beings, we all have an obligation, I believe, to educate ourselves about the disease itself, how it spreads, to understand maybe some of the misconceptions. And so why all of these authorities say, wash your hands, people think that is silly, right? Why am I washing my hands? Well, it's because this virus actually can live for a decent amount of time in microscopic moisture molecules that can be on a surface. So this idea that because I keep myself more than 6 feet away from other people, well, frankly, if somebody sneezes on their hand and then goes and opens a door, and then I'm 6 feet away, I wait for them to be gone before I open the door, well, I've now touched the same doorknob and it exists on that surface. So this idea that just by maintaining physical distance from people somehow makes everything better, again, educating yourself about the disease helps you then respond as an employer in the physical space in which you find yourselves. Additionally, don't forget things like the ADA, HIPAA we talked about before. These things still apply. That being said, you are able to take steps and implement measures as an employer that in the past you could not do, such as, and I love these examples, right? You can take people's temperature, right? You have one of those thermometers. I don't know if you want to be doing that at the office. I feel like you're taking a lot of liability by swiping everybody's head. Who knows what you're spreading that way. But the point is there are things you can do in order to prevent the spread of this disease because it is a pandemic, because of the declaration of a state of emergency that under HIPAA and the ADA and other rules in the past you could not do. But that being said, it doesn't mean you can do everything. All right, this doesn't suddenly transform your office into a police state. Okay, so there are certain things like discrimination that you should not be doing. HIPAA, you should not be looking into people's health information, sharing all the health information with everybody. Stay focused on the strict purpose of what you're trying to accomplish. That being said, the one last thing I want to say on this slide is ultimately as an employer, there are 3 goals that I've been hearing people sort of share, right? Goal number 1 is that they're trying to protect the employees and their families from getting sick. Number 2 is to maintain operations. And number 3 is to avoid liability. Well, let me tell you, first and foremost, you're not going to be able to keep everybody healthy. I appreciate the effort, but you can't control who they're going to, who they're physically encountering, what they're doing at home, what they're doing off hours. You can't control that. And chances are people are going to get sick. It's going to happen. That's outside your control. The only thing you can do is try to reduce the amount of people get sick, the length of time it takes in which people get sick to sort of, like they say, flatten the curve. do your best. Maintaining operations, anything you can do to try and keep people healthy, let's say working from home, that's going to ultimately benefit operations. It's difficult to work remotely when you're used to an in-office environment, but if people are getting sick, that's going to be even worse from a productivity standpoint. I think the number one thing you need to be looking at, and it feels cold to say it, is to avoid liability. If people are going to get sick, inevitably, don't let it be your fault. You don't want to be that organization that introduces it to a geographic area. So you need to be taking steps ultimately to try and reduce the likelihood that someone is going to get sick or ill in your environment. Focus on what you can control. Next slide. So understanding that these are sort of your goals, many of the FAQs that we're seeing being directed to people like the CDC, OSHA, et cetera, regarding these rules and requirements are available online. In particular, we pointed out some of the ones that we seem to be seeing ourselves. Things like, can you ask somebody to work from home, right? Yes, absolutely. We always tell people, oh, if you're sick, work from home. Give it a little bit more force, okay? I understand that in the past it's like, well, if you're sick, you can work from home, but golly, I sure would like you to be here. No, this is not a negotiation. Can you take employees' temperatures at work determined? Yes. So again, you're monitoring for symptoms. It's not only a matter of telling people if you feel sick, work from home. It's we have the right to monitor you, and if we see symptoms, we can order you to work from home. If somebody is positive, tested positive, again, it's not just that employee who needs to be monitored, but everyone who works around them. Again, you're not, you don't want to alienate or ostracize people. You're not going to say, hey, did you hear Joe is sick? But ultimately, I think we need to recognize that people are going to know, and it's important to understand that that employee shouldn't be alienated. We should do everything we can to try and support that employee. And also, we need to make sure everyone who came in physical contact with them is also being monitored, but not in such a way that maybe they end up taking it out on the person who is sick. So we have a lot of HR issues that need to be covered as well, in addition to compliance. If you want to go ahead to the next slide, Matt. Thanks, buddy. So I know that now Brady is going to sort of take us out on this one. Again, Brady, before you go ahead and get started, I just want to thank everybody for dialing in thus far. And again, we're going to cover a lot more of that workplace safety in a future presentation. Brady?
Thanks, Ron. Yeah, I mean, we could cover each one of these sections really in a separate presentation, but quickly on HIPAA, I want to remind everyone, because there's a lot of rumors going around out there, both on the news and we've heard them as well. HIPAA is not suspended. HIPAA is still in force. Back in February, the HHS released guidance saying that HIPAA is still effective during a pandemic. They have guidance that applies in these cases. And just remember that for PHI, you have the right to share patient information for treatment purposes, for public health activities. If the CDC is contacting you for information, that's okay. For disclosures to family, friends, and others involved in the individual's care, or if they've been in contact with that person, and to prevent a serious and imminent threat to the workforce or to the nation. So be aware that HIPAA is still applicable here. Know what the minimum necessary standards are. Only disclose what you have to disclose, and we'll have more to say about HIPAA in the coming days and weeks ahead. And
so going to the last slide, guys, we're closing it out. Thank you to everyone who joined us. Let me just say very quickly, we covered today 4 things that really you need to keep in mind. 1, what do we know about the changing laws, obligations on the part of a benefit plan? 2, best practices, particularly changes to make to your plan and dealing with stop loss. 3, as an employer and frankly as a responsible professional and human being, what do you need to be looking out for? And then 4, what can we expect in the future by way of new laws, new regulations, and things you need to be keeping an eye on? Understanding that those are the things we talked about today, we will take a deeper dive into some of these topics in the future. In the meantime, if and when you have questions regarding this or anything else, direct the inquiry to us. If it is something about which we do not have information, chances are we know someone who does. If it's something about which no one has any information, you just struck gold and we will investigate. That being said, please, number 1 and most foremost, take care of yourself and your family so that we can continue to enjoy these talks in the near future, specifically April 23rd at 1 p.m. Eastern Time. We look forward to hearing from you. We look forward to talking to you. Please stay healthy, be well, and thank you for allowing us to help empower your plans. Thank you.
Thank you.